If you're pregnant, you cannot take medication, and you should not take medication. And chiropractic is the perfect fit for somebody that's suffering from not only back problems, but just wants to have a good, comfortable birth. Hi everyone, Dr. David Kulla here, Synergy Wellness in New York City. So today we have an interesting case, and we've been seeing her for a while. This is Dr. I'm going to leave her last name out, okay? We'll call her Dr. Dogood, and she is a pediatric physician here in New York City, and she takes care of the little ones, and she's actually pregnant right now. So why don't you tell people what brought you in here? And,
Well, I was having lower and mid back pain for a long time, and I wasn't allowed to take any pain meds, and regular traditional medicine wouldn't help. So I decided to seek another opinion, and has been really helpful so far.
Yeah, so you've seen me for a few visits already. Something really important here to discuss when you're pregnant, you don't want to be polluting your body. It's so important to eat right, and just what you put in your body, even prior to being pregnant, for months and months, and I would assume even years, would be helpful. So chiropractic is the perfect fit for someone that's pregnant. Now, she's not suffering from a breech pregnancy right now, so we do a technique called Webster technique if there's a breech, and that helps the baby's head to drop down for a good normal vaginal birth. But we had a conversation recently about the birth process and how traumatic it is to the baby, to the cervical spine of the baby. And I actually did I showed a research study on our YouTube channel about that, the dangers of upper cervical subluxations called CEAS syndrome in infants. But we're not going to get into that. What I want to get into here is the point that if you're pregnant, you cannot take medication, and you should not take medication. And chiropractic is the perfect fit for somebody that's suffering from not only back problems, but just wants to have a good, comfortable birth, okay? So that's what we're doing here. She did come in for back pain. Most people do come in for back pain. After a few more visits, I'm sure she's going to understand that it's more than just back pain. And she is a physician. She's a pediatric physician here in New York, so she understands it. She gets it. So it's a little bit easier for me to get that point across to her. But we're going to go ahead and show you how we adjust her. Now, she's got a little bit of extra, belly size here. So we're going to drop this piece down to give her a little bit more room, make her more comfortable, make the baby more comfortable. That should be enough. Let me know if you need to if I need to drop it more.
It's good.
Okay, so she's got some mid-back pain. Now, obviously you don't want to, we do sometimes give her heat up here on the mid-back, but not for long, because you don't want to increase her body temperature. But for those of you, I don't know if you can see this, but her whole pelvis, and this happens every time, and try to straighten out if you can, just to see if, so when she does that, it helps a little bit, but you can see her whole pelvis here on the right side is shifted forward, and this pelvis is pulled back. So I'm going to exaggerate it a little bit, kind of like that. This is pulled down, the top of the pelvis here, and this one back. And this has been her pattern consistently, okay? Now, that pattern could be muscle memory, it could be her gait, flat feet, flat foot on one side versus the other. There are a lot of different things that could cause this reoccurring pattern. But what a chiropractic adjustment does is break up that neuroplasticity in the cortex of the brain, breaks up that pattern and says, wait a minute, this isn't right, this is right, and we're going to correct it and put it in its right position. And that over time breaks up that neuroplasticity or that muscle memory in the brain. And that's why long-term chiropractic care has proven even more beneficial. And when have you ever heard that long-time use of pharmaceuticals, you benefit from that? Nobody has ever benefited from a long-term use of any medication, or even a short-term. So that's the beauty of chiropractic. All right, now you can see here, her leg is shorter by about ½ inch on the left side. So that also confirms that her pelvis is pulled back on this left side. Now, when I do this? See how her legs bend, and this right leg is more flexible. This right leg goes closer to the buttock, the heel to the buttock. But look at this one on the left. And I'm pushing evenly, right? Mm-hmm. This one on the left doesn't go as far. If you look, it's about 5-6 inches off, you know, the space between this heel and her butt and this heel right here in her butt, right? So we need to correct that. That just confirms that this pelvis is pulled back. So we're going to go ahead and correct that right now. If you could give me this side up. So we were also talking earlier about culturally how in some parts of the world a C-section is thought to be the better option. That is not true. All the literature states that. It's not even really an argument. A vaginal birth is much safer for both the mother and the baby, and less traumatic. But not to say a vaginal birth cannot be traumatic to a baby's cervical spine, an infant's cervical spine. But in certain parts of the world, like Central and South America, we were speaking about how most people get C-sections, and you said poor people are more inclined to get vaginal births. That's fascinating. It's backwards too, but everybody should be getting a vaginal birth, not a C-section, unless you absolutely need to, and you know there's an emergency, obviously. Okay, go ahead, take a deep breath in and blow out. Good, and the other side up. As you can see here, we brought the abdominal piece up again just to make her flat, and then we'll lower that again. Good. Now we're going to take the other pelvis, which had gone, if we're referring to the top of the pelvis, had gone forward, right? So I'm going to contact the lower part of the pelvis, the ischium, and we're going to drive that from P to A. All right, take a deep breath in and blow all the way out. Okay, good. And lay on your stomach. Okay, now look at that. You may not be able to see, I'm going to try to zoom in for this video, but look at that. Her legs are now even. Now watch. Voila. That looks even to me. Her quad is still a little bit tighter. I can feel a little bit of tension on that. You feel that? A little bit of tension in the front of your quad, your front of your thigh? On that left side, but it's much better. Now it's going evenly. Look at that. See how much closer that is? They're even. Okay. Now she has a little bit of tenderness. Is that sensitive?
A little bit.
Okay. So because she's got the extra weight in the belly, and she's secreting more elastin hormones in the body, so she's getting more flexible. The ligaments and tendons are loosening up to make room for the baby. That's the natural process here. Tender there. Mm-hmm. Take a deep breath in and out. So the belly's dropping down and causing like a lower cross syndrome. Okay, and if you are pregnant and you already have weak abdominals and weak muscles in the glutes and the hamstrings, that's going to create even worse problems for you. And that's why she's a little bit sensitive here. So lower cross syndrome is when the belly drops down and creates problems in the lower back. I've done some other videos on lower cross syndrome. Make sure you check that out. But tender right there. Okay. And deep breath in and out. So what I'm doing here is just releasing some trigger points along L5, S1. And are you tender there? Okay. So these are just trigger points along the sacrum and L4, L5 region. Good. And any tenderness there? Okay. And how about there? Okay. Right there? Okay, take some deep breaths in and out. Good. So we're going to check her sacrum next. So the sacrum sits in between the pelvis on the left, the pelvis on the right, and it's this triangular bone you see right here. Here's the side view of it. We're going to do a check to see if her sacrum is rotated to one side or the other. We have 4 ligaments that connect the sacrum to the pelvis on each side. So what I want you to do is keep your pelvis flat here. Just raise your leg one at a time. Keep it straight. Raise it up as high as you can. Good. And down. And the other one? Okay, good. It doesn't seem to be rotated at all for me. Otherwise, she would have difficulty raising one leg, or one would go higher than the other. And was it difficult to raise either leg?
This one a little bit more.
This one? Okay. So go ahead and try that again for me. Okay, and the other one? Okay. So they were going up evenly, so I'm more inclined to think that's muscular and tender in there. Okay, so she's got some trigger points here in the glute, so we're going to release the trigger points in the glute.
Oh my God.
Right there, okay. All right. Right there. Okay, take a deep breath in. And then we'll check the sacrum again. Good. So do you have any names yet?
We have it, but it's not a surprise.
It's a surprise?
Yeah.
Okay, you hear that, everybody? It's a surprise. The baby's name.
We finally have one.
All right. Oh, you just came up with one this
Yeah,
week?
yeah.
Okay. All right. Does anybody else in the family know the baby's name?
Nobody.
That's a good one there, huh?
Yeah.
So a lot of times, people with really bad trigger points, I might laser the trigger points, but because she's pregnant, we're not going to do that. Let me know when that trigger point eases up.
It's better now.
It's better?
For sure.
Okay. And tender there?
No.
Okay. There? There?
Just a little bit.
Okay, it's going to be a little bit more
Oh,
here.
yeah.
Yes, okay. All right. So you're keeping not only the name, but the sex?
No, it's a boy.
Oh, it's a boy.
Yeah.
Okay, you hear that? It's a boy. Great. And when are you due?
November 20.
Okay, so
I'm halfway.
yeah, she's about 4.5, 5 months in, right? Now, for people that just have weak abdominal muscles, weak hamstrings and glutes, you could certainly strengthen those areas, at least the glutes, pretty easily. If you find out you're pregnant or trying to get pregnant, it's something that you should start to do. Not only eat well, eat healthy, right? But you take your prenatal vitamins. Strengthening your core should be part of that, so you have a comfortable pregnancy. Okay, now I'm going to have you raise your leg one at a time, and okay, the other one. Okay, they're both going up evenly. How was that? Was that easier to raise?
Yes.
Yeah, so that was muscular. It wasn't the sacrum rotated. If the sacrum, again, was rotated, you would see she wouldn't even be able to raise one leg, or there would be a big difference within a few inches. We're going to go ahead and check this again. Good, that's still balanced. Again, a little bit of tightness in this quad, so we're going to correct that, and we're going to adjust her mid-thoracic spine. So I'm going to have you turn over on your back. Okay, so it was your left quad. If you could bend that leg for me. These are some of the tightest muscles in the human body, along with the calves, especially for women, the calves, because of the heels. But this gets worse when you sit, and we're all sitting more. We're working from home, we're not working as much, or whatever it is, working more at the desk. The more you sit on the couch or on a chair, any chair, the tighter your hip flexors and quads are going to get. So it's important to stand up and just do this runner's stretch. It's a nice simple stretch, and then you can go into a lunge and stretch your hip flexor. Okay, I'm going to have you cross your arms in front of you. Now she has a little bit of rotation in her mid-thoracic area, and that creates her pelvis to come out of alignment. So we're going to go ahead and correct that. And that can be sometimes for people that sleep, half on their side, half on their stomach, because when you do that, you're twisting at the mid-back, twisting at the pelvis, and shifting things. So again, it's best to sleep on your back. So tuck your chin, take a deep breath in, and come on up. Yep, right there's good, and blow all the way out. Good, and one more deep breath in. Good, and blow out. Okay. Hands up in the air. And cross your arms again for me. Yeah. And this time you're just going to do a half of a sit-up. So your shoulder blades, deep breath in, good. And blow all the way out. Relax. Okay. So when you're doing a sit-up, by the way, you should never come all the way up past your shoulder blades. So right about the bottom of your shoulder blade should come off the floor or off the mat, the yoga mat. And that's it. You don't need to come all the way up unless you want to hurt your back. So if you have a disc herniation or a bad back, don't do that, okay? Just come up partially so the bottom of the shoulder blades come off the floor. And that's enough. And then support your head, don't pull on your neck. Just some key things there with crunches, and if you decide you are going to strengthen your core and your abdominals. You feel that on the setup?
Mm-hmm.
Yeah. Relax here. Okay. There we go. Good. Any headaches at all?
Yeah.
You have had headaches. Okay. Just in the last day or two, or?
No, actually, like last week.
Last week, okay. Let me know if those persist, okay? And relax yourself here. Wiggle your toes. Okay.
Feels so much better.
What's that?
Feels so much better already.
Great, great. You're all set. You can come on up.